Hey, how are you out there, Facebook? It is Lori Hoy from Full Fit Life, along with
Dr. Fawn Schaefer from Fresh Start Chiropractic.
And this is my sports bra eating dog, Seneca. And many things, but mostly.
Really like me right now.
No, she's a little strange today, but it's all good. It's all good. So anyway, we are here again on a Wellness Wednesday. Hey, Chandler.
Hi, Chandler.
How are you? And we are coming to you live from my kitchen. Yeah. So we're going to have a little bit of a different venue, but it's no worries. We're still going to talk about something important to those of you out there that are suffering with some other joint pain we haven't discovered or we haven't talked about yet, which is
knee pain.
The knees.
I've been kind of avoiding it because it's very complicated and tricky, but I'm going to at least give you the basics of some knee stuff because I mean, anybody and everybody has some kind of a knee issue at some point in time. So,
yeah, I have been. Now, when I started my my wellness journey back last January, for those of you that have followed me, or even for those of you that haven't, I started looking at my nutrition last January because I was having a lot of issues with my joints. I mean, mostly my knees. Mm-hmm. And because I teach Dance Fitness, I was, 3 days a week, always on them, and then whatnot. And the only thing I could do left was take a look at my nutrition. But we're not going to talk solely about that today. But that is one thing that we will definitely, as you always know, we will hit on.
Yeah.
But I was just having like this chronic achy knee, or I'd come in from working out and I'd sit down for 10 minutes and get up, and it would just feel like I was not my age, like far advanced in age. I won't say what age because I don't want to offend anybody, but maybe like 105. How's that? We don't have a lot of people that live.
Yeah, that's it. I feel like you're 100.
So,
and I too have a bad knee, and I mean, I feel like isn't that the joke? As you get older, you don't have left and right; you have good and bad.
Good and bad knee. This is my good knee. This is my other good knee.
Yeah, and so when my nutrition's off, that's my window to my health. If my knee starts to swell up or hurt, I know I'm doing something wrong nutritionally, and I have to look at it.
Oh, that was the cat door.
There's another cat. I missed it.
It's Hoy's farm out here. We have 2 dogs and 2 cats. So just ignore the barks, the whatever, the sniffs, the jumping, sneezing. Yeah, Jazzy could stand to be in the salt room for a day or 2.
I can tell she can't breathe very well.
She would do well in there.
So here's what happens. So you have 2 kinds of knee problems. There's the people that have done something like maybe in a workout or maybe just walking up the stairs and they feel something, twist or tweak or something, and then their knee starts hurting. Well, they know they did something to their knee. So that's called an acute knee problem. And we're going to talk about that first in a second. But the other one is what Laura and I have both been talking about. There's chronic knee problems that everybody has. Well, not everybody, but a lot of people have that knee that just comes and goes. It gets mad sometimes, and then it calms down, and then it gets mad, and then it calms down. So let's talk about the acute knee problem first. Now, there's so many different things knees are pretty darn complicated. So if somebody calls me and says, my knee hurts, what can I do? If I'm not actually physically holding your knee and doing some things to it, I can't honestly tell you what you did.
Right.
But it's just like any other injury. I know this dog
now she's warming up.
Any other injury, it's resting, icing, and compressing for a second. So if you're doing a lot of exercises like we do in our workout groups that require a lot of jumping and running around, you don't want to do anything like that. Like maybe keep your exercise for 7 to 10 days to like walking or something without a lot of impact and a lot of sudden movements is what's bad. Mm-hmm. So resting it as much as you can that way, icing it every night if you can. And then a lot of people ask me about bracing. Well, bracing is okay for a minute because bracing will strengthen your knee temporarily, and it will actually, give you the support you need if you're going to be on your leg for a long time and you're worried that something's going to go bad. But people that wear braces all the time, braces actually weaken your knee because the biggest thing about your knee is the muscles around it are what strengthen it. So if you're constantly wearing a brace to take those muscles out of the equation, they're going to weaken. And when you don't have the brace on, you're more likely to hurt your knee. So braces are okay if you have one. Like I have one and I wear it when my knee gets ticked. Mm-hmm. And I'll wear it for a week or 2 until everything calms down. But then I try to get it off as soon as I can because I don't want my muscles to weaken more and lead me to more injury.
So does that same thing happen if you are chronically wearing like KT or rock tape? Does that have the same effect as a brace, or is it because that comes off like every 2 or 3 days?
Well, yeah, in a way, depending on how you tape.
Okay.
A lot of times KT tape is designed to actually let you continue to use your muscles. It just gives them a little support. So it's not exactly the same. So if you are doing some kind of a sport, like if you do volleyball or soccer or something, and you want to tape it just for the support during the game, that's okay. So most KT tape, that's the idea of it, is it actually lets you continue to use your muscle without completely stopping it from working. So it can be a little different. It depends on the thing. So, but when it comes down to an actual injury, an actual somebody like me or a physical therapist or a medical doctor will do some tests on you to tell what kind of thing is wrong in your knee. And then, so if your knee pain is actually pretty bad and it's lasting more than 7 or 10 days, you should get a professional opinion to figure out what's going on.
Okay.
So that's an acute knee. I can't, like I said, there's 100 different ways to tape it depending on what's wrong with it. And the braces are always okay. Like I use one of those simple compression sleeves that just gives all around pressure when you're really, really ouchy and you're trying to like throw people around for a living like I do. I'll wear it at work and things like that. But sometimes an old injury will actually flare up, or you might have a little arthritis in your knee that will kind of flare up. And those are those chronic knee injuries that we talk about. Okay. I know everybody, and I know I've heard her knee and I've heard my knee. You know, they make that noise when you do a squat.
I used to call it Rice Krispies.
Yes, exactly.
Like snap, crackle, and pop. That's basically what my knees do every day.
Yeah.
There was an exercise I was doing recently. Oh, I was running stairs. And I was like, what's that sound? And I was like, oh yeah, that's my knees.
But you can, and people, it's normal for knees to kind of grind like that and kind of pop like that and not have a lot of pain. It just means that you've done something to it in the past and it's trying to remind you. But as we know, that then they can flare up, because why do we get flare-ups?
Well, we get a surprise in the freezer that your husband left, and you go and you eat it and you don't even know what's in it, and it seems to be like something not nutritious.
Yeah, she's brave, because he said there's a surprise in the freezer.
Julie.
And she just
Hi, Patty.
Put it in her face.
Yeah, so going back to what I said earlier is I started my journey last January, and the first thing that I discovered is that by eliminating added sugars in my nutrition, it helped my knees. And I was like, wow. I mean, it was like it within a month. And I can't pinpoint it exactly, so I'm going to just say that was probably an average time. About a month in, after I've cut out all added sugars from my nutrition, and I don't mean just sugar in your coffee or sugar in your tea or iced tea or ice cream. I'm talking about turning labels, reading ingredients, and anything that was listed that had to do with I eliminated completely. And within a month, I had such marked improvement. I couldn't believe it. So I thought, well, there must be something to this.
Absolutely.
So then that's when I further investigated with grains and dairy and legumes. So yeah, so it's kind of, I do like a pseudo Whole30. And I know some of you that have been watching Dr. Fawn, and some of you have been attending her recent classes on the Whole30, but all that information they can get online as well too. But it's nice that if you are someone in our area and you haven't met up with Dr. Fawn about Whole30 and you would like to get more information, please make sure you send her a message, because it's been I've heard a lot, nothing but good stuff. And I was there to one of the events, and it's just something you got to try.
Yeah. And it's, like I said, when you eat inflammatory things, it's going to come out where you're weakest. So if you have that bad knee, that's your, like I said, that's your window to your health. If your knee's acting up, and then you have to look at, what am I eating that I could probably get rid of? And
I think that's the last place that people think is, oh, it's my shoes. I know that's another area that you can always improve on too, is your footwear.
You could, and your feet are your foundation. So if your shoes are bad and you're walking around on concrete or uneven ground, it can affect your knees. But really, a lot of knee and not any other joint pain can go away if you look at your diet.
Yeah.
So long story short, knees are complicated, but do the regular rest, ice, compress it if you need to, and then if it's not better in 7 to 10 days, talk to somebody and see what else is going on.
And so you can do adjustments on just knees only if that's what someone wants.
Absolutely.
Okay. So
I can adjust knees. We also have in the office, the cold laser does a lot of. It's anti-inflammatory. It helps things to heal.
Yes.
So when people come in with a real true knee problem, the laser really is one of my favorite things to do besides adjusting their knee, because you can adjust the bones of the knee and then laser it to help get the inflammation out of there temporarily, as long as you're not eating more stuff.
Oh, sure.
So that's the other thing that we can do with knees.
Now, I've heard of red light therapy beds. Are they similar to the thing that you have, the one, the light that you use? No,
that's not the same thing.
Okay.
But it's not bad for you. It won't hurt anybody.
I just was wondering. Because I was going to say, you can just laser my whole body.
Patients have asked if I have a tanning bed that just gives the laser. Because that's a little different, but it won't hurt you either. So the red light beds are okay.
Okay.
But
I just didn't know for sure if it was the same process. But anyway. All right, guys. Well, unless you have any other questions about knees or anything else, we are looking for more ideas.
Yeah.
I'm kind of...
We're almost out of body parts.
Yeah, we are. Well, ones that we can talk about appropriately on Facebook.
Or any other things. Like last week we talked about allergies and sinuses, and we can just give us ideas and we're happy to give you
anything for health and wellness.
Something.
And it doesn't necessarily have to be that either. We could, who knows, we could go on the road for this show.
Yeah.
Wellness I think wellness amasses a lot of different things, not just your body, but your emotional health, physical health, your emotional health and physical health. They're the two main things. And so I'm also up for talking about anything about emotional health. That's kind of like my thing. So
we can do that too.
So
meditation,
if you, meditation,
Maybe we just gave ourselves a new idea for next week.
Maybe. I know I meditate twice a day.
Yep. I meditate once a day.
Yeah.
She's got
anyway. Doesn't mean it works. Certain moments. And there are certain times during the day I start to meditate. Anyway, if you have any other ideas that you would like for us to chat about or research, please feel free to message either myself at my fitness page, which is Full Fit Life, or my personal page, or you can find you at
Fresh Start Chiropractic. That's my business page, or on my Facebook page, my personal one, Fawn Schaefer. Or you can call the office or email me or whatever you need to do. But get a hold of one of us.
Yeah, just let us know, and we'll be happy to share with you what we know.
Yeah.
All right. Thanks, guys. Have a great day. It's beautiful out there, at least here in Pennsylvania. It's gorgeous.
Yeah, and get out there and enjoy it.
We're not going to have too many more of these days, I don't think. So it was great having you guys chime in. Talk to you soon.
See ya. Bye, guys.